Assalamualaikum warahmatullahi wabarakatuh. This video represents how to get 5 vital signs, which is temperature, pulse rate, respiration, blood pressure, and oxygen saturation.
So now, I'm going to start by taking my patient's body temperature. And there are a few sites which we can obtain its body temperature from. It could be through oral, rectal, axillary, temporal, or through tympanic temperature. So for today, I'm going to take my patient's body temperature using or through axillary side. You're gonna have to pull off your sleeve so I can put thermometer, okay? So this time I'm going to use a digital thermometer for my patient's body temperature using axillary side. Before I'm going to place it in the area, I'm gonna take a look and see in the area if it is moist or wet. Okay? Please raise your right hand, ma'am. So after that, we are going to wait for the thermometer for beat. Okay, so after this happen, I'm gonna need to inform my patient about her body temperature, and of course perform hand hygiene and disinfect the thermometer, and also to document the data I have gathered. Okay, mom, it's beating. So mom, your body temperature is 36.5 degrees Celsius, which is in the normal rate. So we just have to disinfect the thermometer. So it is important to know that the axillary side is 1 degree Celsius lower than the oral temperature. And of course, after that, I'm going to document the data I have gathered on the patient's TPR sheets. That's all.
Pulse rate. To check your pulse at your wrist, place two fingers between the bone and the tendon over your radial artery, which is located on the thumb side of your wrist. When you feel your pulse, count the number by 4 to calculate your beats per minute.
So, hi ma'am. By the way, I'm your nursing student and you are? Okay, so I'm here to gauge the pulse rate. So first all, provide privacy. Assess the comfortable position of your client. Position the client's arms along the side of the body. Then place your first and second, third finger over the artery. Then after that, don't forget to using the watch and count the number of position and fill that to 30 seconds and then multiply by 2. Then after that, don't forget to document noting the routine, and that's all.
Miss Johaira. I am Johaira Haji Unus Sampaso, and I will be your student nurse for today. So for today, I will be assessing your respiratory rate to check if you have a normal breathing or if you use any accessory muscles or just identified any underlying medical conditions. That means to be giving immediate care right away. So is it okay, ma'am, if we start now? Now I have assisted my patient in a supine position. Then say what you want to do. Is to cross your arms, please. Okay, so we're gonna assume that my patient has taken off his shirt. And I will insert video clip demonstration to show what to observe in the abdomen. Inhale for me and exhale. Inhale and exhale. So the movement of the abdomen is albeit and normal, and the abdominal muscle contract in the lungs with its respiration. So my patient chest expands during respiration and the shoulder rises, and during expiration the shoulder and chest falls.
Blood pressure is the pressure circulating blood against the walls of arteries. It could be obtained by using stethoscope and sphygmomanometer. Prior to the procedure, I will do the introductory steps, which is to ensure the privacy of the patient and provide comfort and do the hand hygiene. And I will introduce myself to my patient and tell her the procedure all about. I am Sunny Siti Aina. I am your student nurse, and I will get your blood pressure. And is it okay to you, ma'am?
Yes, ma'am.
And you are?
I am Siti Amida.
Prior to conduct the procedure, I have already checked my equipment if it is all clean and if it is all well functioning. So since my patient is sitting, I'm gonna make sure that her feet is both on the ground, because blood pressure increase if the legs is crossed. And I put her arms in heart level, because if her arms is in lower level, it could give us higher blood pressure reading, and if her arms is in higher level, it could give us lower blood pressure reading. And I'm gonna do the preliminary palpatory determination on her systolic pressure to avoid having a lower systolic reading. Sphygmomanometer above her 2 centimeter above her systolic pressure, and I will palpate her brachial artery using my 2 fingers to find the brachial artery, and I will start to inflate the pump. The estimated blood pressure of my patient, and now I'm using this stethoscope to get the actual blood pressure of my patient. The 110/70. The systolic pressure of her blood pressure is the 110, and her diastolic number is the 70. To get the systolic number, systolic pressure and the diastolic number, the first beat that you heard on the stethoscope is that is the systolic pressure, and the last beat that you heard in the stethoscope, that is the diastolic number.
In this video, I will going to show you how to get the oxygen saturation of my patient. But before that, I will do the hand hygiene and introduce myself to my patient and what I will do with her. So So ma'am, I am Siti Amilia Makabantog Aminuding, and for today I will going to get your oxygen saturation of your body. So to get the oxygen saturation of my patient, I will going to use this device which called digital pulse oximeter, or the one that connected to the bedside monitor. So to do that, I will place this device to the finger band of my patient to do where it obtained the rating. Make sure that you pick a good circulation and warm and nice the finger of your patient. And turn on the device that you will use. And put it to the finger of your patient. And let it get the read. As you can see in this video that the patient has a 97% of oxygen saturation. The normal oxygen saturation is 95 to 100%. After you see the result of the rating of the oxygen saturation of your patient, you remove it and clean it with the disinfectant. And after it all, you can document the findings.
어느 날 세상